Tell me what's going on with this back.
So it's like my lower back, like on my hip is like bulging.
So is it your butt or is it actually your back?
My back, like right here is where the pain is coming in, and it really hurts on long runs.
What are we talking long?
Anything over, once I hit like 3 miles, it really starts kicking in.
All right, fast running, jogging, sprinting, anything.
Anything, just extended movement over a period of time.
Okay.
Really starts getting.
All right, I won't make you hurt your neck too now. How long has it been for?
2 years.
2 years, okay, here we go. So chronic back pain, you get to get put in that category. Is it every day or only when you run?
Only with strenuous physical activity.
Okay, nothing first thing in the morning, nothing after you get sleep, standing. You can sit and stand, no problems.
Yep.
All those things. You can get in and out of any height car.
Yep, no problem. It's more running, like I would say even more running on the road as opposed to like trails.
Okay.
And then
how about golf?
I don't golf.
Okay.
But when I hit legs or even some back, sometimes like I feel my whole back stiffens, but it really comes from the
low back. Okay, so everything gets in the spasm. Okay.
Yeah.
So I'm gonna have you sit in the center of the table, and I am gonna work on this posture. There we go. So let's first go here because we can't check anything until I actually have you in a good posture. So I'm looking to see what kind of level and where your spine actually is based off of palpating. Now, if I go right here, does it hurt?
No.
How about this one?
Nope.
And how about down here?
Nope.
Okay. So cross your arms across your chest and lean backwards. All right, take a rest. I'm gonna turn you around so that you guys can see. You're gonna put your back that way.
Sure.
All right, so we're gonna check to see the level of his hips and see where they are. So we're seeing that the left is a little higher than the right. Are you right-handed or left-handed?
Right-handed.
Okay, so the left is higher. And then we're gonna have you slide your butt into the center of the table a little bit, perfect. And you're gonna cross your arms across your chest, and we're gonna look at each one of these vertebrae and see what they actually do. So I want you to lean back until your mid-back hits my head. Good. Anything hurt?
I feel the stretch for sure.
Okay, and then come back to center. Good, and then lean it back. Good, and then center. Worse or the same?
A little better.
Okay, and come on back. And worse or the same?
A little better.
All right. And let's do one more down here. Good, and relax. And your pain has all been here when you run.
Yep, it's there and it'll shoot down into my butt.
Into your butt.
Too, yeah.
All right, so can you side bend your right elbow down to the table?
Like here?
Yep. So what I'm looking for to see if the spine actually moves. It moves here, great. It does not move so much through here. And come back. And let's go the other way. See how that goes? A lot better. All right, come on back up. And arms across your chest and rotate to the right. Pain?
No.
Pinching?
Not too, yeah, a little bit, not too bad.
All right, and turn the other way. Any pain or pinching?
No.
Okay, and then back. All right, you can relax your arms. Any discomfort through here on the tailbone?
No.
All right. Let's put your head here on your back, please. All right, so we're gonna check to see if it's disc. So does that hurt?
No.
You get to relax, you don't have to tell me. Does that hurt?
No.
All right, and how about this one?
Nope.
Is it always on the left side that your discomfort is?
Most of the time, if I keep pushing it, the pain will extend out.
Extend out and go the whole side, okay. And when you get the pain, how long does it last?
Until I stop.
Oh, and you keep doing it, right?
Yeah.
Oh, okay. Can I have your hands? Yeah. Come up to sitting. Good. So I'm going to check your hip levels to see where your pelvis, because when you were sitting, you had one elevated. And so when I look at this, I'm looking at your alignment based off of knowing that your legs are the same length.
Sure.
That you have a leg that seems to be not in the proper alignment. And you're going to lay back down. Good, and that popped on the way down.
Yep.
Yeah, so when it pops, you know, you have a part of you that's not holding the stability. So when we do it normally, you should have your stomach tight and your tush tight so that pop doesn't happen, so that the muscles are engaged. Because otherwise it's just the ligament popping over that and kind of makes it really uncomfortable. All right, so if I do this and do that, does that hurt?
No.
Okay, how about this way? Oof.
Nope.
When's the last time you stretched your butt? Oh my goodness. Most back pain is caused from butt tightness. And how about that? Nope, you're gonna keep that foot right there.
Right there.
How about that? No problems, no issues, nothing tightness.
Stretch, yeah.
Just feel stretch
Right
through
there,
here.
yep.
Okay. All right, we're gonna do the same thing on the other side. All right, and if I come out, any issues? Got great range of motion there. I'm not sure what happened over here.
Yeah. This is where you get stuck.
Stuck. All right, so we're gonna give you a full-fledged stretches for your butt. And come on over here, and I'm gonna turn a little tighter.
Tighter, yeah.
Yes. Any pain?
A little bit.
And is the pain here or more in the glutes?
It's like right here.
The whole leg.
Yep.
Okay. How about if I bring it over this way?
It's just tight.
All right, now if I come here, do you still have that pain or you just have a nice stretch?
Just a nice stretch.
Good. So if I'm pulling
a little bit of pain.
Yeah. And super tight again. So this, is definitely knee arthritis a little bit too with that. And we're gonna bend both knees. So first thing I'm gonna do is gonna have you squeeze both of your legs together. Good. And you're gonna now open them. Awesome. And squeeze. So we're just gonna see if we can get some alignment better for you based off of muscles turning on and not being off.
Sure.
All right, so literally something so simple as a shotgun can make your alignment better. Now we did kind of get some pops while I stretched your butt, which will help to release everything and get this levelness to be better. When you run, you're pounding.
Yeah.
And when you run on uneven terrain, you said it was the cement that hurt more.
Yep.
So let's think about, we live in Florida. All of our streets are a little bit beveled because we like the water to run off to the edges. So when you're running, do you stay on the same street when you run so that you run down on the right hand, come back on? No.
No.
So we never level yourself back out. So your right foot potentially is always in the gully versus the left.
Yep.
We need to change that. Your terrain does matter, and the streets and how you run, so that if you're gonna go one way, let's try to even it out and go back the same way, or run something that's flat. Tracks are a beautiful thing for that reason.
Yeah.
It has some, vibration. Now, if I push on your hip down, does that hurt?
It hurts on that one.
On the left side.
Yep.
And it doesn't really spring so well. It's kind of got a brick wall for me.
Yeah.
So we're gonna try to release that. So that, think about a woman in a bathing suit, you can see the dimples, okay? So those dimples are your SI joint. So that's kind of what I'm playing with, is that I'm putting literally my finger right in that dimple, and I'm holding the other side of your hip, and I'm gonna rock this to move, but you have put, I think, cement in there, so it does not move at all.
Yeah, it's been a couple of years.
2 years, so you're not supposed to wait that long.
I know.
When you have pain, you come right away, and we fix it quickly. Now you're chronic, so I gotta do some work. All right, so here's your hip flexor. You don't love that.
No.
The face is great. So it's pretty tight. So I'm gonna keep my hand here, and I'm gonna just rock this leg back and forth, trying to release this. So the muscles on the front and the muscles on the back are too tight, and so they're holding you in a position that's causing you the inability for your hips to move in and out of position properly when you're running.
Is it due to inflammation?
So yes, inflammation has some component of it because, of course, whenever you irritate something, you create inflammation. So that's why cold plunges, ice, good foods with the anti-inflammatories are great, but you also are just jamming it in, so shoe wear becomes important. Are you wearing proper shoe wear when we run?
Yeah, I wear running shoes.
Okay. Not barefoot running?
Not barefoot running.
Okay. And when you go home, do you walk on tile barefoot?
Yes.
Yes. So you are really good when you run, but then you go home and then you just pound it. And you just have nothing to shock. So having that rubber sole is the way to go for that.
So shoes inside.
Shoes inside, slippers, flip-flops, not those little tiny ones, but fit flops that have an arch is the way to go. All right, as painful now on this spot?
Not as painful, no.
Okay, all right, let's check this alignment again. And bring those hands up. We're looking right through here. Now, when you came up, did that hurt?
No.
Okay. Now you have your ankles level. All right, and then lay back down. You popped again. You did not hold your stomach or your tush tight while you did that. Now, I want you to squeeze your butt like you have a $1,000 bill between your cheeks. And then I want you to rest. And then I want you to squeeze. And then I want you to rest. Good. So that's engaging the glutes. And your whole body should rise off the table, which it does. So now let's have you roll to your right side. Because your hip flexor is so tight, we're going to stretch this hip flexor from here because the muscle's here and it attaches back here on your back. So I'm going to take your leg. I'm going to relax. I got it. And I'm going to stretch you all the way back. And you have much more flexibility because you're making this lovely back arch. So try to keep this nice and flat. Sure. There you go. Stomach's tight, and let me just have the hip. Feel the difference?
Yep.
And then I'm going to add a little quad by bending your knee, which you love. You can see the face. It's good. And we're going to release. Good. And then let's have you sit up for a second. So how you're going to stretch it, you're going to bring those legs around that way. All right, so we need to really stretch your glutes. So if you're sitting in a chair every day, you want to cross your left foot over your right knee.
My left foot over my right knee.
Yep. And you want to try to push that knee down straight. So mine's down here. Yours is not bad. Good. And you want to keep equal weight on both of your butts. There you go. And then you have it straight down. Now, if you need more of a stretch, you lean forward. You feel that pretty good in that hip.
Yep.
Good, and then relax. So that's an easy one, no excuses, you can do it at work.
Can do it at work.
Now, when you are, before you run or you're in bed, you do the same stretch, but you're laying down and you just bring those legs up towards your chest.
Okay.
So that's how you do that stretch. Now, we gotta do one other stretch, your hip flexor. Let's have you stand and face that way.
Okay.
So you're going to bring your left leg back. Actually, I'm gonna have you turn the other way just so that you're facing me. Good. Put the left leg behind you and up on its toe. Good. And you're going to go into a little bit more of a lunge. Good. Then you're going to bend that left knee and the right knee till you feel stretched. You're going to lean back slightly on that left hip. So I'm going to bring you up like this. Your head's going to be better. Your hip's going to go forward. You're going to raise this left arm. Okay. So now we're elongating this whole entire hip flexor. So you're going to keep this stretched position and you're going to try to side bend and feel that stretch all the way down into your hip. And you got to do it on a regular basis. And you got to breathe. Must breathe. Must breathe during stretching. Good. And then you're going to come back. So every day you want to stretch your hip flexors. Everyone thinks you have to lay on the ground. You don't. No excuses. You can just stand there, do it, have the stretch, be able to raise and then lean, but you'll get the full length of that muscle. Pelvises are mean. Let's talk about how you get in and out of the car. Do you step in the car or do you put your butt in the car?
I step in the car.
Okay, most people do. If they open the door, they step in the car.
Yep.
So what we need to do is for the next 24 hours, put your butt in the car and then both legs together. Same way of getting out. So kind of keeping yourself equal. Right now, you're standing like you all probably do on one leg, not that both of them. So you always want to stand with your legs at least shoulder width apart so you have equal weight on both sides. Okay. That will help for all back pain just because unfortunately, the tendency is we all do this. So it will allow for that to relax. Next. Right now, does it hurt standing there? No. You're not running, of course, but usually what we do is check, so bend forward as far as you can. Do you have any discomfort in there? No. And come back up, do you have any discomfort? Nope. And then you're gonna put your hands on your hips and you're gonna lean backwards. Do you have any discomfort? Nope, a little tight. It's actually hyper flexible, that's the problem, but we'll get that later.
What does that mean?
So you have too much range of motion in certain planes and no range of motion in other planes. So it becomes this muscle imbalance of trying to create stability with flexibility and have the strength around it to hold it. So if your hip flexor is really tight, but you have all this extra extension in your back, this is where you're getting the motion from. You're actually not getting it from the hip.
Got it.
And so we have to kind of make sure that when you're doing these stretch, this is all flat and perfectly tight so that when we're doing it, we're actually stretching at the hip.
Got it.
Does that make sense?
Yep.
And then you have to make sure that you don't get in and out of the car stepping in.
Okay.
And you have to stand and sit equally on both butt busts.
It's going to be difficult.
But if you do those things, it will make your pain less when you go run. And let's talk about running. You can't run only on the right side of the street. If you have a problem with the leg being lower, you're going to create this over and over and over. So find a terrain that's a flatter that you can run to and from on a flatness, or if you run out 1 mile, then you're going to turn around and run back on the opposite side so that it gives you that same unfortunate deficit, but to equal you out.
Sure. Are there any other stretches that I should be doing for lower back before I run?
So before you run, ideally, most people get out of their car and go running. Is that how you run? Or do you get up and stretch a little?
I do a little bit.
You do a little calf stretch. Yeah. So yeah, ideally I like bring your legs as wide as possible, and then you're gonna go straight down towards the ground and hang with no bounce whatsoever. And then you're gonna walk both hands to your right, stay down there. And then you're gonna walk both hands to your right leg and pull yourself down. And to do that, then that requires a cross pattern stretch. And you want to breathe in this point because then it's going to help things relax. And then you're gonna walk both hands to the center and then hang for a sec and then walk to the left. And when you do that, what you're doing is allowing for the back to relax because you're doing it over time with breathing. And then you come back to the center. Now, when you come back up, don't be mean to your back. Put your hands on your knees, bend your knees, and push yourself back up. You just elongated the whole back. Now we want to actually be kind to it and assist it to come back to extension. So that's probably my favorite one. It pops, it cracks, it gets everything to move. It doesn't necessarily help with the pelvis. The butt stretch is by far the number one. And you can do it seated, you can do it standing. I've done it plenty of times. Hold on to a sign, cross your leg, and then sit in it.
Okay.
And when you do that, you can stretch just the same.
Sure.
Okay.
Awesome. Well, thank you.
You're so welcome.
This has been awesome. I feel better already.